This is Dr. Lisa with Private Practice Made Easy, your turn to lead. And in this video, I'm going to talk about the pros and cons of an in-person versus telehealth practice. So let's get to it. Thinking about starting your own private practice, one of the first and most important decisions you'll make is whether to go fully telehealth, in person, or a hybrid model. Now, I prefer for my patients a hybrid model. There are some patients that like to see me in person, so I'm in the office every Monday and Tuesday. But, I like to work from home as well. So on Wednesdays and Thursdays, I work from home, see my patients virtually. And then on Friday is my administrative self-care day. And then I have the weekend, so I can really, truly enjoy my weekend. So let's break down the pros and cons so you can choose the best path for your lifestyle, your patients, and your business goals. All right, let's start with telehealth. All right, as we know, after COVID, telehealth really got accepted and it really became on the rise, and for good reason. Number one, flexibility, work anywhere. I have a daughter and granddaughter in Florida, so I get to fly there whenever I want to see them. My practice doesn't stop. I just keep going. No one tells me what I need to do or when I need to work. I just keep going, and I can also enjoy my family. So see patients from anywhere, whether that's your home, your office, or while traveling. Lower overhead. If you're a full telehealth business, then you don't have any rent. You don't need a waiting room. You don't need or have any utilities. That means more of an earning in your pocket. Number three, broader reach. You can serve clients across your entire state, not just your local area. I serve patients on the entire state of Texas, the entire state. So instead of just being enclosed to my geographic area, I get all of Texas. So that gives me more clientele. All right, now let's talk about licensure with a telehealth. Licensure is state. So within the state, you can practice. So if you only have a license in Texas, you can only practice in Texas. You can only see patients in Texas. Now, you can be anywhere else, but your patient has to be in Texas. Now, that doesn't stop you from getting licensed in other states. So you could go to Louisiana and see patient and get a license there. You don't have to be in Louisiana. Your patient has to be in Louisiana, but you could open it up to that state. So one of the things when we start a private practice is we kind of want to see where the need is, what state, how you can get licensed in a different state based on the need. So we have to think about licensure and compliance. You must follow state-specific telehealth laws. So we've got to look, because every state has their laws about telehealth. And we want to ensure we're HIPAA compliant when it comes to technology, which isn't hard because all the EMRs are HIPAA compliant. The phone systems now you can get HIPAA compliant. Not hard, because if you're doing anything in regards to in the medical or a psychiatric realm, you're going to purchase things that are specifically for providers. All right, tech issues. Now, internet glitches happen. I see a lot of patients in rural areas, so I always have to have that backup plan for them. Sometimes I have to use the phone, and you have to specify in your notes that it's a phone versus a video. So sometimes that helps or happens, and it helps to always tell your patient that if we have a glitch in internet or something happens, I will call you. All right. And also, not all patients are tech savvy. So sometimes on that first visit, if you're on a telehealth visit, you want someone else there just to get them set up. So especially with older patients. All right, therapeutic connection. Some providers feel less connected. Some patients feel less connected with their patients through a screen. So that's another thing to consider with telehealth. telehealth. I will tell you, I have diagnosed a patient and could have misdiagnosed a patient if I had seen them in person. And how did that happen? That is because I was able to see them in their environment. So through the screen, I could see what was going on. It was actually a patient that had some obsessive stuff going on. And so I could see that they were doing some things, collecting things excessively. I would not have seen that if they had come into the office. So there is an advantage sometimes when it comes to seeing a patient in their own environment. All right. Now, on the other hand, in-person care offers a more traditional and structured approach. Many times there's a stronger rapport. You get to see more of their body language. Now, I can see from, the chest up, and sometimes I'll only see someone's head. So in a telehealth type of situation, but when you're with a patient, you can actually see them in their gait as they walk into the room. You can see their total body language, eye contact, and it can the office space can kind of enhance the therapeutic connection. So you have to think about the stronger rapport. That's number one with the traditional structured approach. Number two, licensure and insurance. So payers and licensing boards are often more familiar with in-person standards. So you have to, based on the state, you have to figure out which insurance companies expect you to see patients or will only pay you to see patients in person. So that's another thing. So if you're going to be credentialed through these insurance companies and you plan on just doing telehealth, it's a waste of time and money to get credentialed with an insurance company that says, no, we will only pay you, we will only reimburse you for a in-person visit, okay? And so that's something to take into consideration. The last thing I want to talk about with traditional and structural approach is hands-on service. For providers offering assessments or procedures, you have to be right there, okay? If you're doing history and physical, and there is some technology, I will say, like if you have the technology where you can you can do what we call remote patient monitoring. So we can do the blood pressure at home, all the vitals. You can even listen to the heart and the lungs. So if you have that set up, that's fine. But there's some other things with the history and physical, reflexes, things like that you will have some problems with. So we need to figure out, do we need to have that hands-on service for our patients? All right. Now, in-person care does come with more overhead. So think office rent, think staff, because somebody's got to be at the office, at the front desk, where telehealth, you can have a virtual assistant that is more cost effective. You have furniture and you have local marketing. Okay, so your reach is limited to your geographic area when we're talking in-person practice. And of course, your schedule may be less flexible with in-person type of practice. And you have to think about your commute time. So for me to get to my office, it takes me about 40 minutes. 45 minutes sometimes, okay? So that, and wait, if there's an accident, it's going to be an hour. So that's 2 hours sometimes a day that you're commuting. So if you're in person and you're commuting and it's 2 hours a day of your time, that's 10 hours a week. So you want to consider that as well. But if you do get a practice, you might want to consider something that's close to you in like 10, no more than 15 minutes. Okay. All right. So do you value location freedom, in a leaner business model? That's my question to you. Do you value location freedom in a leaner business model? So if you do, telehealth is probably going to be the option for you. Or do you thrive on face-to-face contact and connection and a routine? Do you thrive on face-to-face connection and a routine? Then in-person is probably going to be best for you. Is your target population comfortable with a telehealth platform? If you are doing geriatric patients, telehealth is not going to be good for you. It's not going to be good for you at all. So look at your population. Think about what you have to do, your service. Think about also your life-work balance. So there's lots of things to consider. It's just not, oh, I'm going to do telehealth. It's what's my population look like? What's the service I'm providing? Looking at your financials and your work-life balance and what's best for you and your family. All right. I hope this has been helpful. And if you need help setting up your private practice, I can help you because it's your turn to lead.